Establishing an understanding of how to use facility equipment is important for all Zeta Labs personnel. This guide will provide you, the researcher, with an in-depth walkthrough of the safe and effective operation of ZCA-001. Before entering ZCA-001, make sure you have a flash drive ready to record your scientific data. You will find a box of them next to Orson. It is also advised that you and those who accompany you don the ZM Tech SB1 soundproof headphones sold at ZM Tech Gadget Rental. It's time to head to the Inorganic Asset Study Wing. When escorting patients, always have a guard present. For Zeta Labs operations, an SRS BCU operative is recommended. Ensure your patients pass the metal detector. Then head to the Subliminal Manipulator. You may now enter the control room and prepare the unit for startup. This is the control board. It is composed of 4 sliders, 3 switches, and 1 lever. The ALC, or airlock control switch, toggles the 2 doors leading into the anechoic sound chamber. Begin by opening the first door. Staff must wear ear protection past this point. Should any personnel enter the anechoic sound chamber without ear protection, activate the chamber telltale, or TTL switch, by holding it down for 5 seconds. This signals the imminent use of the speaker system and clears operators of any liability. When ready to begin testing, ensure that all sliders are set to 0, then turn on the power. Listen to the audio playback inside the control room by hitting the PB switch. The white gain slider amplifies the strength and volume of the audio signal. To subject patients to the audio signal, increase the slider. When the gain is set too high, subjects may experience severe migraines, indicated by a sudden onset of severe twitching, heart palpitations, indicated by collapsed subjects, and cardiac arrest. After a few heart palpitations, patients are likely to die. For the safest results, operate at or below a 0.5 gain setting. If the patient's health is of concern, a medical staff member may tend to the patient inside the chamber, given that they have soundproof headphones equipped. The 3 sliders control the macros, also known as markers. Markers are defined as time-stamped reference points embedded within the track. These sliders adjust linked parameters such as volume, EQ, and reverb for each marker. Macro 1 has been known to modify strength. Macro 2 modifies intelligence. And Macro 3 modifies agility. Further testing must be done to determine the results of different combinations. After some time, your patient will either mutate or prematurely expire. Congratulations! You have successfully created a ZCA-001-1 instance. An ordinary instance is generally identified by a protruding spine, disfigured head, scarring, and loss of intelligence. Their speech is also inhibited as a result of damage to Broca's area. Continuing to expose these instances to the audio file has been known to unlock the potential for evolution. After a successful transformation, it is recommended to subject instances to an extra 15 to 30 seconds of audio. Different combinations of macro settings will result in different mutant attributes. Use the exposure scanners to view your subject's qualities. Further experimentation may be done in a containment cell. The most common failure you will encounter is a speaker stability failure. To properly respond, personnel must return to their risk management training and use the 3 Ps. Perceive the failure. Visual and auditory warnings will alert researchers to a failure. Process the failure. Determine whether the best course of action is to lower the volume via the gain slider or disable power via the lever. Perform the decided recovery steps. In our example, we will choose to cut the power to ZCA-001. Once it is verified that the failure has been resolved, normal operation may continue. Other failures may include, but are not limited to, gain calibration failure, macro linkage breakdown, airlock malfunction, power disruption, playback error, soundproof glass integrity loss, system overload, control panel failure, noise containment breach, audio distortion from macro settings. For these more uncommon issues, refer to the emergency handbook. After collecting data onto your flash drive and concluding your test, ensure to dispose of ZCA-001-1 instances. The ethical method is termination through the Zeta containment chamber's disposal protocol button. The unethical method, however, is death by a firing squad. The Zeta Medical Corporation cannot legally condone this method. Your knowledge on mutant study is now up to date. On behalf of the Zeta Medical Laboratory team, we appreciate you taking the time to view this orientation.